According to the Global Healthcare Access and Quality Index report, Nigeria ranks 140 out of 195 countries in healthcare delivery. The state of healthcare delivery in the country is considered appalling, and there's been too much national lamentation over the situation for too long. My guest on this week's episode of the program talks about the nation's healthcare delivery system. Hello there, thank you for joining me on the program this week. I'm Gloria Umezuke. The Nigerian healthcare delivery system is a source of concern to all and sundry because of the needless deaths of compatriots and the capital flight that the health sector has come to represent over time. Well, while the wealthy routinely fly out of the country to seek medical expertise, the middle class struggles to access the few private healthcare centers in the country. And the poor are left at the mercy of poorly managed healthcare centers. Well, I had a conversation with the Minister of Health on the nation's healthcare delivery system. But up ahead, the Minister of Health, Professor Adewole, says Nigeria is not fully prepared for health emergencies. Well, according to the minister, the nation needs a stronger synergy among government agencies to strengthen disease surveillance and control. Well, take a listen. 2014, only 8 cases were recorded during that time. As of June 2017, a total of 501 suspected cases, including 104 deaths, were reported following the latest outbreak of Lassa fever in 17 states. According to the Nigeria Center for Disease Control, a total of 14,518 suspected cases of meningitis were reported from 25 states, with 1,166 deaths. At this meeting with the Joint External Evaluation Committee, the Minister of Health received the report of a national self-assessment to evaluate the nation's response to health emergencies. The Minister of Health then decried the nation's low performance during health emergencies and declared that the nation's preparedness for health emergencies is weak.
To me, this is like a mirror. And what you've done is to say, please look into this mirror and see how you look, how prepared you are for emergencies. And the answer is simple, we are not yet there. So we must not leave it to God, we must leave it to humans. This is a situation where we must take charge of our destiny.
The outcome of this process, which is backed by the World Health Organization, highlighted the need for Nigeria to make additional investments and apply concerted efforts to improve its performance in key areas.
The areas that require improvement are laboratory services, we need to improve on them. Our port health services, we need to improve on them. And some of the legislative frameworks that we have.
It needs a strong commitment from the government of Nigeria, from the Nigerian people, and from the legislature, from the National Assembly. And building on that, Nigeria's CDC can work with the other agencies and ministries to really build a network, because it's not one entity. It's not in the US CDC alone, but CDC is a focal point, and that's exactly what Nigeria's CDC is working to become.
The objective of this evaluation is for Nigeria to strengthen her response system to future health emergencies. In our interview segment, I had a conversation with Professor Adewole on the nation's healthcare delivery system. He talks about the health interventions in the Northeast, as well as steps taken to address outbreaks of diseases. Professor Isaac Adewole, you're welcome to the program.
Thank you, Gloria.
Well, let's quickly find out about this. Earlier this month, the ministry carried out this emergency nutrition response for children in IDP camps across the Northeast. Really, let's understand the situation right now at present.
We actually did not carry out our health nutrition emergency response this month. We actually started in January. What we did last year was to declare a nutritional emergency in the Borno State because of the high level of malnutrition. As you all know, malnutrition is a major issue in Nigeria. It is worse in Northwest than in Northeast. But what we are encountering is a higher level of acute malnutrition in the Northeast because of the insurgency. But 35% of the children in the North have malnutrition, which to me is a source of concern to many of us. So we declared a nutritional emergency. We had polio outbreak. We also declared a health emergency because one case of polio alone is an emergency. And so we prepared a blueprint for addressing the health and the nutritional emergency in the Northeast, particularly Borno State, where over 60% of their facilities have been destroyed. And so when Mr. President then initiated a task team through the Vice President, now acting President, it was quite an opportunity for the Ministry of Health to hit the ground running because we already had the blueprint to be implemented. And so the task force headed by the Honorable Minister of State for Budget and National Planning is chair of this panel, comprising my humble self, Minister of Agriculture, Water Resources, Interior, with NEMA being part of this outfit. So we were ready. And we went there quickly. January, we kickstarted this program, and we shipped massive amount of drugs, nutritional materials, equipment to Borno State. And on February 1st, we started the emergency response.
To be distributed across how many hospitals?
We are working in 25 local governments. Okay. We have 325 health workers across